Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Our top story this week is the pricing of alirocumab. Sanofi and Regeneron set the wholesale price at $40 a day, which is well above what analysts had predicted. FDA approved the first-in-class PCSK9 inhibitor for limited groups of patients, although its label does allow interpretation over who can get this cholesterol-fighting drug. While payers will get discounts, experts predict they will strictly limit who gets the drug until the competition drives down the price. The next important deadline for this new drug class is August 27th, when a decision is expected on evolocumab, the competitor from Amgen. A study published this week found a link between hospital readmissions and patients who received a high number of prescriptions when they were discharged. Research from BMC Health Services found that those readmitted within 30 days were younger, more likely to be African American, and much more likely to have health problems such as heart disease, COPD, diabetes, or metastatic cancer. The relationship between being readmitted and a high number of discharge medications is tied to two factors. First, it indicates disease severity, and second, the more medications patients receive, the less likely they are to take them all correctly, which can lead to readmission. Health and Human Services Secretary Sylvia Burwell this week made $100 million in new funds available to combat substance abuse, with a special focus on helping states fight opioid addiction. Burwell announced the new funding at the National Governors Association summer meeting, where state officials shared ideas for combating prescription drug abuse and treating heroin addiction. Death rates from heroin have tripled since 2007, and Burwell said the problem is reaching every part of the country and every demographic. Our new contributor, Dr. Toby Ogbechi, writes this week on how commercial payers can respond to the heroin crisis. You can read her column on ajmc.com. The Office of the National Coordinator of Health Information Technology will award $38 million to 20 organizations to promote national efforts for better care, smarter spending, and healthier people. Dr. Karen DeSalvo, the ONC coordinator, said the grants will help provide better care coordination at the community level. The focus of the grants, which will be rewarded through 3 programs, are to promote interoperability, to help 15 communities promote population health strategies, and to update materials that will train healthcare workers to use health IT in multiple settings. The new inhaled insulin, Afrezza, hasn't always received great reviews from Wall Street, where analysts have been critical of its slow early sales. But don't tell that to the patient with type 1 diabetes who are fans of the therapy. A groundswell of support for Afrezza on social media is creating media attention for the drug, which is about to be the focus of a direct-to-consumer campaign from Sanofi. Social media plays an important support role in the type 1 diabetes community, as AJMC heard from Carrie Sparling at our conference, Patient-Centered Diabetes Care.
I can't speak for all the patients who are living with diabetes, but as far as this one particular patient goes, it connected me to my peers, to my tribe, and it showed me that I wasn't alone. And living where I live in Rhode Island, and I don't know a lot of people in Rhode Island who have diabetes. I was able to map a whole community of people using social media to kind of get my footing with my peer group.
You can read about how Sanofi is addressing the spirometry requirements for Afrezza in the current issue of Evidence-Based Diabetes Management, available at ajmc.com. Finally, this week marks the 50th anniversary of the law that created Medicare and Medicaid, the 2 largest healthcare payers in the country. More than 55 million Americans are covered by Medicare, and more than 71 million are covered by Medicaid and the Children's Health Insurance Program, including 12 million who have joined the program in the past 2 years under the Affordable Care Act. The very first Medicare recipient was President Harry Truman, who got his card from President Lyndon Johnson at the signing ceremony on July 30th, 1965. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.